Welcome back into Talking Fitchburg. Joining me this morning is the president and CEO of Agrace Hospice and Palliative Care, Lynn Myers. Thank you for joining me.
Thanks, Jeremy.
Glad to have you on the show. And today we're talking about affiliations with UW Health Unity Point affiliations.
Right.
So what is Agrace affiliation with those two organizations?
So about a year ago, we approached all three of the health systems in Madison and shared our vision for kind of coming together and collaborating around end-of-life care. So we didn't compete around this very important part of the healthcare spectrum. And we had a variety of discussions with all three health systems. And in the end, it continued to move forward with UW Health and Unity Point Meriter.
Perfect. So with those two, why did Agrace and UW Health, Unity Point Health decide to partner with you guys?
I think when we approached them with our vision of let's do what's right for the whole community, Agrace is very fortunate in how we're viewed in this community, kind of a gem in the community. Both health systems really saw the value in coming together and collaborating and improving how quickly and easily they can access hospice care when they're in the acute care setting.
Absolutely. And how are local patients and families benefiting from the affiliations?
You know, already this has not even been in place for a year yet. And already we're seeing when patients are in the hospital or maybe they're seeing a physician over at the health systems, their path towards getting either palliative care or hospice care, and those are different, is much smoother, much more quick in terms of kind of understanding the options available for them.
Yeah, you can kind of get things going right away in the hospital if you have a diagnosis or something, which is nice, I can say.
Yes.
Going through it right now with a family member, and I
Yes.
was telling you before we got on the air that it is a really smooth process, I have to say. So you guys are doing a great job
Thank
there.
you. Thanks.
Does this mean then that Agrace will only help patients with UW and Unity Point?
No. In fact, what's interesting is the overwhelming majority of the patients that come to us for help, a family member calls on their behalf or they call on their behalf. Certainly, we get patients directly from the hospitals or the clinics, but we get them from Dean physicians, we get them from St. Mary's, we get them from the Monroe Clinic, we get them from Mercy. I mean, we are so fortunate, we take it so seriously that we really are considered a gem in this community. We're nonprofit, so we're not all about the bottom line, and we provide services above and beyond what we're required to provide because of our nonprofit status and how much the community supports us.
Awesome. So does this mean that Agrace is now financially tied up with UW Health or Unity Point then?
Nope, we are 100% independent. Our affiliation is really around quality and clinical care and improving transitions. So it's just much smoother for patients and families.
Sure. And then the affiliations overall, how positive is that for Agrace?
It's been great. What I didn't foresee happening and has been wonderful is the affiliation discussion started, as you can imagine, at the highest levels of all the organizations. But that has quickly gone by the wayside, and connections are getting made by nurses and social workers and others that are at the patient's bedside between Meriter, for instance, and Agrace. And those discussions and relationships are really solidifying, so it's making it all the better for families and patients.
Sure. Maybe just to dive in a little bit deeper here, when these affiliations, again, can really start the process faster in some ways.
Right.
Maybe kind of go into that transition where it was and then the affiliation.
So some of the work that we're doing now with the affiliation is working with individuals in the hospitals and clinics who are responsible for discharging a patient or helping case manage a patient who has lots of comorbidities in their disease process. We are working much more closely with those folks, and they are telling us, this is what we need from you, Agrace, in order for us to much more smoothly be able to talk to the family, talk to the patient about their options. These are unique ways you could get more involved earlier on. And so just the dialogue that this affiliation agreement is allowing us to have at the bedside has made it tremendous. You were talking about your family friend, and that's a case in point of just how much more smoothly things are able to go.
Yeah, it's pretty cool. The conversation starting in the hospital. You have people in the hospitals
Yes, we do.
that can come and talk with you right away. There was no pressure, wasn't anything like that. And,
Right.
I can definitely see the benefit of having the affiliations. Just gets that process going
Right.
a lot smoother for you.
The other thing that I would point out to your viewers is, because people think of us as the beautiful building that we have here in Fitchburg, they
Sure.
think Agrace begins and ends inside that building, which it's a gorgeous building.
Right.
But on any given day, like let's take today, for instance, we're taking care of 780 people. They are overwhelming majority of them are in their own homes, which is where
Right.
people want to be. And just a minority of the patients are in our facility because their symptoms are just such that they can't be managed at home. And they don't want to go to a hospital. So our facility here is almost like something you could consider to be a hospital for hospice patients.
Right.
But most people, your family friend is a case in point. They want to be in their own home.
Right, and again, we've had you guys on the show.
Yep.
We've kind of talked about that. So if you ever want to find out from past interviews, for those of you who haven't seen or been a part of these, we've got those interviews out there for you to go back and look at that explain the different components that you
Right.
guys have. Yeah, someday we've got to do a tour over there too. We've
always
been in there,
welcome.
but yeah, we should come down and definitely do a tour. So real quick, where can people find more information then on Agrace?
Definitely, our website is the best place to go for all kinds of information, www.agrace.org.
Perfect. Lynn, thank you so much
Thank you.
for being on the show, and we'll hopefully have you back here real soon.
I'd love it. Thank you very much.
All right, we'll take a very quick break. We'll be right back. It is Talking Fitchburg.